If you've been told you need a bone marrow biopsy, it's natural to have questions, but don't be scared. Let's explore this step by step. Let's begin by understanding the bone marrow. Bone marrow is the spongy tissue where blood cells are made inside your bones. Red blood cells that carry oxygen, white blood cells that fight infections, and platelets that help with clotting are all made in the bone marrow. So, now we are talking about a bone marrow biopsy. In this procedure, doctors collect a small sample of this tissue from inside your bones. It can help to find conditions like blood cancers, the cause of anemia, and disorders of bone marrow itself, as well as to check for any infections or issues that affect the production of blood. The procedure usually involves a biopsy on the back of your hip bone. First, your doctor will numb the area with a local anesthetic. Then, they use a special needle to take a small sample of the bone marrow. You might feel some pressure, but the numbing helps reduce pain. The whole process takes about 20 minutes. Like any procedure, a bone marrow biopsy has some risks. You might experience mild soreness, bruising, or bleeding at the site. Serious complications like infections can happen, but the good news is that they are extremely uncommon when the procedure is done carefully. After the biopsy, you can usually go home the same day. You might need a few hours of rest and some pain medications before feeling better. Now you know, while it might sound intimidating, bone marrow biopsy is generally safe and straightforward. If you found this helpful, follow us for more health tips.